Thank you all for joining us. Hopefully we'll try and make this an entertaining, engaging, back and forth conversation. I'm Isaiah. I'm the founder and CEO at Bland AI. What we do is we automate phone calls for some of the world's biggest enterprises. Think JP Morgan Chase, Athelis, Insight Health, doing phone calls at scale. We're a Series B company. We've raised $65 million to date. We've done over 150 million phone calls. 1 in 4 Americans at this point has actually talked to Bland. And we're doing 3.5 million phone calls a week and growing. I'm joined by David here. David is the Chief Transformation and Technology Officer at Guideway Health. And before that, he was the CIO of Memorial Hermann for 20 years.
Yeah, Houston, Texas.
David, do you want to go ahead and maybe introduce yourself, give some background and color on what Guideway Health is doing?
Yeah, well, I know him. You guys here, just curious, are you all vendors that have products, or are you actually in a healthcare system and treat patients and would consider yourself a covered entity? Just covered entities? No? Everybody's kind of in the vendor world, right? A marketer? Okay. Cool. A little bit about who the audience is. So Guideway Care is a patient activation company. And you kind of go, well, what's a patient activation company? And I would tell you this quick little story about a 78-year-old low-income widow who lives in a 3-generation household. That means her daughter, who's usually never around, and 2 grandkids. And as a patient activation company, we've built a model that prompts our 325 agents when we're calling into, and when I say agents, I'm talking human agents, not like software agents like all around this place. So human agents, and we're talking to her and she is not picking up her medication. We know one of the questions to ask is it a money situation? And she'll finally say, yes, it is. And then you always ask, well, are you supporting the grandkids? And the widow usually says, yes, she is. And then you have to turn the story around to a conversation that she also has to take care of herself. So not in addition to the 2 grandkids, but she has to take care of herself. One of the ways to do that is to go and use the little bit of money they have to get her medications and to take those life-altering meds. That's what a patient activation company does. 24 days ago, I was in a small implementation company implementing Bland software at various healthcare systems. And Guideway Care was one of our customers. And it was about in November, and they said, hey, we really think you guys would fit well with us because we need more leverage and more scale. So we brought our clients and we started working with Guideway on additional use cases. And we kind of think of this world like a pyramid, where at the bottom of that pyramid are highly repeatable transactions. And as you go up that conversation is that phone call to that 78-year-old widow, which I'm not sure AI is really ready to make yet. So we're a blended workforce.
Can you talk maybe about how you found Bland and got into AI phone calling? Because I think this is a funny story.
Yeah, actually, we had been working with what I'd call a earlier generation version, and one of our clients said, David, you have to listen to this. And one of Thomas's employees, Jared, had been building on Bland and said, David, you've got to listen to this. And they set me down, and I actually got on bland.ai website, and there's a button in the upper right-hand corner that says talk to us. And I put my phone number in and pushed talk to us, and the agent called me. And I had probably the most efficient 30-minute sales call I had ever had in my career. No disrespect to you, Doug, but it was an amazing conversation back and forth. And that was kind of my first introduction to Bland, and we were kind of hooked right then.
And maybe some color today. How are you using Bland? What's the scale, the scope? You talked about the human calls where maybe AI is ready. I'll disagree with you a little bit there, but can you talk about what we are doing today together?
Yeah, right on. So a couple of really, I think, interesting use cases. One of them is a rev cycle company, and we are doing a financial screen. These are patients that are coming out of emergency rooms, usually with self-pay as their payment status. So that means that they're looking for insurance. And we use Thomas's AWell platform to onboard all of those patients. He just shared with me that last month, I think we were at 189,000 or 183,000 people that we onboarded onto the platform. And we then, through AWell, create a series of touches, text, and then for Bland, we use for all the phone calls. And we've been able to literally improve their effectiveness rate by an order of magnitude of 5. So 5 times more financial screens with less people than when they were doing it with their human agents and auto dialers. And an interesting story, one of the drivers was Spanish. And so you get these files from the hospitals and they say that this is an English speaker. And then whenever the agent connects and it's no English, español, por favor, and the ability for Bland to recognize that and code shift in to Spanish, to have a complete Spanish conversation, and then bring that data back to us in English so we can merge it with all the other data and send it on down through the processing. So that's how I got introduced.
That I love that those use cases, and maybe, coming from the background of being the former CIO of a major health system, thinking about implementing AI, a big topic is how do you not turn this into a phone tree? How do you make sure the patient experience is actually better? Can you talk to a little bit about the work that you're doing to make sure the calls sound great, sort of what you've identified and top of mind priorities when we're doing these sort of more sensitive phone calls?
Yeah, I think that's a really important question. We all implemented software. We got doctors to move from writing orders to putting it into the computer. This is a change management project. And you've got to really think about it as people, process, and technology, just like we always have. There's a methodology to how to build out the experiences. And the one thing that I will tell you is you are never live until you're actually making live calls to patients. You can test all you want. You can get your adversarial testers. You'll get your executive testers. But literally until you're talking to someone in the wild, you really don't know how the conversation will go. And it's through call reviews and some of the tools that we use from them that allows us to learn and reinforce and change kind of as we go on the fly.
Thinking about security, PHI, a very big topic here. There's a whole cybersecurity vendors right over there. A lot of people right now are engaging in what we might call risky behavior. Can you talk about, from your perspective, how you keep patient data secure, how you make sure that we're delivering these calls safely, and maybe a little bit about why Bland was a good fit for that, or even where you see room for the industry to change?
Yeah, well, first of all, anytime you talk about cybersecurity, let's all knock on wood, because I think we all know that it is a ever pervasive risk, and to say that you are ever 100% clear is probably a little naive. Architecturally, what we like about Bland is we're not connecting through a bunch of APIs to a bunch of disparate cloud systems, TTS or transcription from this vendor, LLM from that vendor, voice from that vendor, and kind of niching it together through APIs. Their architecture allows us kind of one place to go, one tenant for our organization, and all of that data stays inside of that tenant, which helps us from a security and confidence standpoint. But also, as we vet this through our larger corporations and larger health systems, we pass through these various security reviews with ease. But again, you never are out of the woods on a security issue.
Can you talk through the implementation process and the work that you've had to do to actually get these phone calls live? What mistakes maybe were made along the way, what things we did well, what things are room for improvement, and sort of what you would want another CIO or someone in your position to take away from your time with Bland?
Yeah. So our team thinks about, after the project kickoff, work along 3 parallel paths. One path is the job to be done, and that's usually with the users. So what's the goal? What's the outcome? What's the conversation? What are the parameters that we're trying to manage to, and what are we trying to accomplish? That tends to be like where everybody wants to focus. Our second pathway is telephony, because the call is coming somewhere, or it's coming to us to be made on an outbound. There's escalations, there's transfers, so the whole telephony channel. And then I think what made us really unique as an implementer is we started a third channel, which was what are the KPIs to measure the success of this particular agent to be. And as we understand the KPIs, the goals, the objectives, how do we design that into that first channel so that we're dropping little bits of data along the way such that we can create a comprehensive measurement system. And that's where we use Thomas's platform, because his data, the Bland data, all lands in the AWell platform, where we use then Looker and some other tools to build these various dashboards that demonstrate to our client that we've improved your screening rate by 5 times, or that 1 in 3 times home health isn't showing up on your discharge patients. So it's those KPIs that are built in to the process that I think is one of the implementation things that we've really learned along the way.
Thinking about the patient experience, I know you're probably sick of hearing us at Bland talk about this, but a huge thing for us is what we call Bland tone, which is how do you make the phone call actually sound great? Because a lot of people are putting pseudo phone trees in production. Can you talk about your experience doing that, and also with the lens of security and where you maybe see people getting that wrong, but thinking about what does a great experience for the patient actually feel like?
Yeah, you do call reviews, which I do call reviews, and you listen to the conversations. And you can hear people recognizing that this is a voice AI agent. They ask about it sometimes. And then sometimes they really develop a level of trust and they start to share openly with the agent. And that's when you know that you really have kind of got a good design of a particular flow or workflow. But it's really putting your ear on it and listening to real live conversations.
One of the things that I think we constantly hear is that there's so much noise in the market, from legacy players that are selling tools to new companies that might have just raised, a pre-seed or a seed, and there's a bunch of players. How do you, as the former CIO of Memorial Hermann, in your current position, how do you think about evaluating a vendor, especially for something like generative AI, especially for voice AI, which is customer facing, patient facing?
Yeah, I think first it's got to be the product itself and the experience. One of the things that we like so much about the Bland platform is the designer tools. So we are not beholden on them as a services model to build experiences for us. So we can log on and we can build our experiences. We have total control of where we want the conversation to go, the global prompts, all of that tooling is there. I think as I've just walked around this showroom floor, it's kind of one of the questions I'm always asking. Are you a platform to build on, or are you a service that'll turnkey something for me, which means that in 6 months when the business change, I'm going to come back and I'm going to pay you again, and you're going to tweak it for me. So Bland is a platform that we build on, not only voice but also text and SMS, and so we're really trying to build more of a multi-dimensional experience off of one core platform.
I love that. Thinking about the other modalities and blending SMS, how do you see that changing patient experiences and interactions, and what's top of mind for you as you continue to build out on Bland?
I think a lot of that, Isaiah, is the creativity of the team that's building the experience. Going to that third channel of what are the KPIs, what are we trying to accomplish here, and then how do we use the different modalities that are at our disposal to achieve the outcome. So a lot of people, we describe it as the warm-up text. The warm-up text that says, I'm going to call you on day 4. Little tips and tricks that you learn to intermix those into a common experience to accomplish the job.
Could you talk about your experience from sort of day 0 to day live with Bland, anything that stood out, and what you would want anyone else taking away working with us or another company from that experience that you think was really relevant?
Yeah, it would be funny because I would say it would be the Slack channel. And somebody's like, why would it be the Slack channel? And we have an open Slack channel with his customer success team. And the thing pings all the time because our team is talking to their engineering team back and forth. Same relationship we have with AWell. And it is that partnership through the Slack channel that really reduces the cycle time for us to build and to deploy. We're stumped, hey, how do we do this? What's the best use of that? And there's a set of engineers on the other side of that that's responding to us. That's one. Two, I'll tell you, the unit economics, I think, are such that, when we went into Guideway, one of the questions were, should we just go hire some engineers and stitch this together and stitch that together and use this cloud thing and wrap it all together ourselves?
Maybe to interject there, just for clarification. So one of the things that we are very proud of here is we don't use OpenAI, Anthropic, or anybody else. So we've actually built our model stack from the ground up. When you talk about stitching, what you're referring to is using a series of different providers where the data has to leave and come back as opposed to one self-hosted. Yeah.
Well, I didn't tell you this, but we had considered doing that and getting off of Bland.
Okay.
So we did analysis and we looked at what it would cost us to go do that ourselves, to separate from you. And this is a point around the unit economics. We kind of came back and said, I don't think we can build it cheaper than we can buy it. And it will be months, if not years, till we have the level of sophistication and feature set that we get from Bland.
And thinking about the data privacy and security, part of what I come back to is, do you think that there is major risk around AI and implementations right now? And where do you see those accruing from a privacy and security perspective with your background?
Well, when you have 183,000, I think it is, right, patients on a care flow, you're over the 500 patient limit. I mean, this is serious work around ensuring every step along the way is encrypted as appropriate, tested. And again, I'm going to knock on wood. You keep coming back to security, man. I'm just so nervous about that. But I think we've done our vetting. We've done the right work. But you never can say never.
Thinking about your next priorities as you scale up, people talk a lot about the whole 95% of AI pilots fail. Talking about what was that put us in the 5% together that we're now at scale and delivering, and where do you see your sort of development with Guideway going next? Anything exciting?
Yeah, I would say when we were a company before Guideway, we worked with a handful of customers, and we were very deep with them in their business and the goals that they were trying to accomplish. And it was not a science project. It wasn't something that we were just dropping off and leaving. So there was a very focus on the outcomes. We weren't the biggest of companies, and so we could create that intimacy. When we think about where we're going with Guideway Care, literally I think every conversational voice company in this place is probably looking at our client base thinking, well, we're going to go convert them off of their human and get them all onto conversational AI agents. And so our challenge will be, like we're the inverted, so it's human in the loop. We are human with an AI in the loop. And so our challenge with Bland will be, how do we go eat our own as we bring more and more of these agentic workflows live and we transition, our human capacity onto these agents.
With the relative little time we have left, just anything else that you would want to share from your time working with Bland? And if you could go back and do the decision again, would you still pick us as your vendor?
Yeah, that's easy. Yes, I'd pick you as the vendor. I think the biggest challenge is the team of people that are working on the project and their passion and their drive for success. No offense, I think I could have taken any of these other technologies and had success, but I think it's this unique combination of your technology and your people working with our people to accomplish, a very specific goal and have very high standards.
I love that. I think that technically brings us to time, although I'm not sure if we have room
Questions?
now for Q&A.
Yeah, until somebody boots us off.
If anyone
Are there
has
any
questions, want to shout them out. Yeah. Some states do require that you disclose that. We recommend that they do that, but it's on a customer by customer basis.
We always do. We always do. And the reality is when somebody answers the phone and you say, "Hi, I'm Hannah. I'm a virtual assistant from so-and-so," they don't always recognize that. And then we've built in all of the conversations when somebody says, "Are you a bot? Are you a this? Are you a that?" It's full disclosure, full transparency.
The goal is not to trick people. It's to be so good that they don't mind either way.
That's the goal. That's the bar that we ought to all be striving for.